Hello, my name is Labria Stevenson, and today I will be informing the audience on some of the ethics of healthcare through two government-based programs that I'll be comparing, which are ACA, Obamacare, and Medicare. And when it comes to healthcare, it's almost saddening to know that I've been so oblivious to it being one of the biggest issues in the U.S. And while reading and researching, I did come across some very interesting and credible and insightful articles and information that really hones in on the ethical struggles within our healthcare system. So although healthcare is advantaged through our government-based programs known as Obamacare and Medicare, there are still some prevalent ethical issues that are known as us not having universal healthcare, our free markets versus central planning, luck egalitarianism, and Medicare decision making. To begin, I'll start just by addressing some of the basics of Obamacare, which is the Patient Protection and Affordable Act of 2010 is when it was established, and it is intended to reform healthcare and is primarily for middle-income families, and its goal is to lower healthcare costs overall. But even with that sounding so perfect, there are some general ethical issues within healthcare that does affect citizens that are trying to get the ACA Obamacare, which are the fact that we don't have universal health care, and the U.S. spends more on medical care than any other country, and ironically have plenty of citizens that actually lack healthcare insurance coverage. And to be more specific, the amount of healthcare spending as of 2016 reached $3.3 trillion, or roughly $10,348 per person. Credit to CMS.gov. The U.S. spends huge amounts of money on the newest healthcare technology, with little efforts of money being directed to society or making the access of healthcare more accessible and easier for our citizens. Robert Blank, which is the writer for the article Transformation of the U.S. Healthcare System, quotes that among the factors that contribute to this situation that are discussed, there are political and economic forces, a political and medical establishment, the dominant private insurance industry, an extensive medical liability system, and in many ways, the most crucial factor, a public that highly values individual rights over communal interests, has unmitigated faith in the technological fix, and is highly suspicious of any government involvement in healthcare. And this quote just supports the idea that the U.S. and the U.S. approach to technology and healthcare is a weird balance. What I found to be most interesting with that is that in comparison, Canada, Switzerland, and Singapore all have free care and still pay a fraction of what the U.S. pays on health insurance and healthcare technology. But moving forward, I'll talk about the ethical issues in healthcare that include patient decision making, known as our free markets and central planning. And free markets are basically healthcare services that meet an agreement between the patients and providers of healthcare with no interference, whereas central planning is solely the government that makes decisions on who, what, when, where, how something will be produced and who gets the benefit from that. So the opposition of free markets is central planning, which is claimed to be what is supposed to overcome free market failure. According to Robert Sade, which is the writer for Healthcare Reform, Ethical Foundations, Policy and Law, quotes that central planning disrupts nearly every aspect of self-directedness, thereby undermining the very human flourishing the planner wants to advance. So basically, he's just stating that central planning is not so great because it doesn't permit the patients to have a say-so in their treatment as they should. He also offers some solutions to this issue by stating that Congress should reform the tax system so that the deductions are equal for individuals and employers. Legislators should increase innovation through competition, and purchase of unwanted benefits should be repealed, and patients should have a say-so in their treatment. And when these changes are made, healthcare should become affordable for a lot that are uninsured and more accessible and appropriate for patients. Next, I'll get into luck egalitarianism, which is honestly the most interesting component of one of the ethical issues to me, because it focuses on how citizens put themselves at bad health risk based off their own choices, and how they can't be justified when it comes to whether or not a provider wants to treat you. So some questions that came up in response to luck egalitarianism is: one, are we to take full accountability for our actions? And two, do we all just make mistakes regarding our health, whether it be diet, no exercise, or smoking, and deserve an opportunity to fix it? Cavallero, the writer for Health, Luck, and Moral Fallacies of the Second Best, quotes that the cost of sloth, gluttony, alcoholic intemperance, reckless driving, sexual frenzy, and smoking is now a national, not an individual responsibility. This is justified as individual freedom, but one man's freedom and health is another man's shackle in taxes and insurance premiums. And it's also important to note that within luck egalitarianism, there is an exception for those who suffer from recreational activities such as mountain climbing or race car driving. However, Cavallero believes that that is unfair, because if it is unfair for smokers to shift their healthcare costs to others, then it is also unfair for mountain climbers to do so, or should be unfair for them to do so as well. And I can agree with that. But now I'm going to wrap up just the basics of Obamacare and some of the general ethical issues that can affect Obamacare and just healthcare in general. I'm going to move on to Medicare and get into the comparison of ACA and Medicare. But first, I'll start with the basics of Medicare. So what is Medicare? Medicare is the financial solution for elders 65 and up that cannot afford to pay healthcare expenses. Medicare covers services such as lab tests, surgeries, doctor visits, and supplies like wheelchairs and walkers, and anything considered medically necessary to treat a disease or condition. And healthcare in America for elders 65 and up is definitely advantaged with Medicare, yet there are still some ethical issues. But according to Medicare.gov, the Medicare plans, Part A covers hospital care, skilled nursing facility care, nursing home care, hospice, and home health service. Part B covers clinical research, ambulance services, durable medical equipment, mental health, inpatient, outpatient, prescription drugs, partial hospitalization, and also getting a second opinion before surgery. Part C and D are associated with private insurance through the government solely. Davis and Rowland states that Medicare has provided elderly Americans, and especially poor elderly Americans, with the opportunity to benefit from the many advances of American medical technology, most notably treatment for heart disease and cataract surgery, and to gain improved access to the healthcare system. Financial concerns can still interfere with access to needed medical care, especially for those who have the most health needs or are very ill. It turns out that Medicare healthcare still isn't enough to cover all medical expenses. And what I found to be most important to pull out of that quote was that financial concerns still interfere with access to needed medical care and treatment, and especially affects those who are extremely ill and really need it the most. Also, that it turns out that Medicare healthcare still isn't enough to cover all medical expenses. And Barbara Lyons, PhD, states that 81% of Medicare's elderly beneficiaries had private supplemental insurance, often called Medigap insurance, in addition to Medicare. 10% of Medicare beneficiaries had neither Medicaid nor private insurance to supplement Medicare. Therefore, all that's left is to pay out of pocket, which can really suck and be unfortunate for a lot of individuals. And actually, I conducted an interview with my grandmother regarding her experience with Medicare. And she told me that her primary insurance is Medicare. However, she has Coventry as a backup to cover the excess fees and any other Medicare expenses that just won't be covered for various reasons. And she also believes that it's not fair for any citizen to have to pay copays and co-insurance fees for health insurance and health treatment, and believes that healthcare should definitely be completely free for all. And in conclusion, although healthcare is advantaged, per government-based programs known as ACA and Medicare, there are still ethical issues that are prevalent, such as us having, universal healthcare, free markets versus central planning, like egalitarianism, and Medicare decision making. So today I informed the audience on some of the ethics of healthcare through the comparison of two government-based programs known as Obamacare and Medicare. Thank you, and I hope that this speech was insightful for you.